Hi friends, myself Dr. Neeraj Kumar Yadav, working as oculoplastic surgeon in Lucknow. Ptosis. What are the important points in history taking of a patient of ptosis? There are 10 important points that includes to make a complete history in a ptosis patient. These are, first of all, age of onset. Ptosis कब होती है, whether it is congenital or acquired. Congenital, early teen, late teen, or in adulthood. Age of onset is very important. Next important point is mode of onset. The ptosis occurs sudden of onset or insidious in onset, progressively increases slightly over a period of time, weeks or month required to develop complete form of ptosis, mild, moderate and severe, or a sudden onset of ptosis. So mode of onset is very important in case taking history of ptosis. Which eye? The laterality is very important. The ptosis, whether it is unilateral or bilateral. Like if there is a unilateral ptosis, acquired ptosis, then the cause may be something different. If it is bilateral ptosis, congenital ptosis, most of the ptosis of the congenital ptosis are unilateral, sometimes it may be bilateral. The congenital causes of ptosis is very important, mostly idiopathic, sometimes maybe blepharophimosis syndrome, superior rectus weakness, or Marcus Gun jaw winking syndrome. So these are the common causes of the congenital ptosis. In acquired ptosis, there is the neurogenic ptosis, myogenic ptosis, aponeurotic ptosis and mechanical ptosis. But in all the cases, to differentiate between whether it is congenital or acquired, the history taking is very important, and these points must be covered in history taking. Then there is a, if there is a, whether there is a history of double vision diplopia or not. Type of deviation, whether it is if the deviation is present or not, and then if it is present, then it is whether it is continuous, constant deviation or intermittent deviation. Whether there is a history of photophobia. If there is a photophobia, then in examination must check for corneal sensitivity, and photophobia is an important point in history taking. Asthenopia. Asthenopic features like patient feel periorbital, retroorbital pain or discomfort, especially during near work or some focused activity. Then asthenopic features, if it is associated with asthenopic features or not. Then prior treatment in the form of occlusion, in the form of spectacles using, or in form of any prior surgeries or prism treatment. These are very important prior treatment given for this ptosis. Then family history is very important, like in family, is there any family history of CPEO, is there any family history of BPES, blepharophimosis ptosis syndrome, myasthenia gravis, muscle dystrophies. These are the important leading questions in the family history. Then medical history, child's medical history is very important. Birth weight, whether it is the normal delivery, full term, vaginal delivery, or cesarean section, or it is obstructed labor or birth asphyxia, history of birth asphyxia. So these are the very important, and what are the birth weight at the time of delivery. Now the development is very important, whether the child achieve milestone adequately with the age at the corresponding age or not, and whether it is the developmental delay. Then schooling is very important, whether the child attain or child take schooling at the limited time, at the required time or not. Neurological development, assessment of neurological development is also important. Allergies, history of allergies, because allergies are immunogenic reactions, can lead to long-term allergic or immunogenic reactions lead to the development of ptotic like features. Now fatigability Fatigability, stress test is also important, although, and sometimes patient says in the morning ptosis doesn't appreciable, but at the time passes or in late evening he feels certain amount of ptosis. So in history, in overall, 10 important points are very important for assessment of all the clinical possible causes and all the possible dimensions of the ptosis is very important for in especially in assessing the history taking of the ptotic patient. Thank you.